Before my device and before my medications, I just wasn't able to walk. I just couldn't go upstairs. I'd have to rest in the middle of going up a flight of stairs. But now I don't even know I've got a problem. And it's a miracle.
Well, I think that the future is real good for me, and I just intend to live the life, the active life, as long as I can. So.
Unfortunately, congestive heart failure is not at all rare. We find over 400,000 new cases of congestive heart failure in this country every year. What's happening in any patient with heart failure is that the pumping capacity of the heart is reduced. In other words, the heart just can't squeeze hard enough. It can't push out enough blood with every single beat to meet the demands of the body.
Prior to the device, my God, I felt pooped out all of the time.
They gave me no hope. Doctor told me that there was nothing they could do and that go home and enjoy every day.
Traditionally, doctors have used medicines to treat heart failure. Now, for some people with heart failure, there is more help when medicines just aren't enough.
Most recently, one of the most exciting developments in the treatment of heart failure has been the ability to use implantable devices that make the heart pump more efficiently and more effectively on top of what medications can already do.
Medtronic, the company that first introduced cardiac resynchronization therapy, is the same company that first developed implantable pacemakers more than 40 years ago. The therapy is called cardiac resynchronization because a special heart failure pacemaker delivers the therapy that helps coordinate or resynchronize the pumping action of the heart.
Resynchronization therapy is directed at taking that irregular and ineffective motion of the heart and changing it into a synchronous contraction that really makes the pumping action much more efficient and effective.
About the size of a small pocket watch, the Medtronic heart failure pacemaker is implanted under the skin in the upper chest. It contains a high-tech battery and the computerized circuitry needed to correct the heart's pumping action. 3 insulated wires are also inserted into the heart through a vein during the implant procedure. These wires are then connected to the pacemaker.
This is not in any way like a bypass operation or a valve operation. The incision is about 2 inches long. As I said, the patients are awake, breathing on their own, and the recovery from it is really a very brief one.
Yeah, they explained to me that it would be an overnight stay in the hospital. And I think I may have been down there for at least a couple of hours. Then they brought me back up and monitored me overnight. And the next morning they came in and tested the device to make sure it was okay, and then I was home.
As with any surgical procedure, there are potential risks and complications. Patient results can vary, and not every patient's response to cardiac resynchronization therapy is the same. It's best to speak with your physician to learn more about the possible risks and benefits associated with this procedure.
Patients typically ask me, "Doctor, what is the chance of this making me feel better?" And based on our experience and also what we know from the large clinical trials that have been done, I tell patients there's a 2 out of 3 chance that you're going to feel a lot better. That's what we've seen, and it's been pretty consistent.
Medtronic made my pacemakers, so they're at the top of my list for medical devices. Also, I did research to see if they did do a good job. And I read about their history. And every time I call that company, the service reps you know, don't make fun of my questions, but they treated me like I was a human being and that my question was important. So they treat people like they care.
In my mind, the benefits of the device are clear. You take someone whose life has been extremely impaired and restricted, and you give them the ability to do more, to feel better, and to have a better life.
I'm ready for the grandkids to bring on the little 4-year-old, 6-year-old, and 8-year-old. Bring them on.
One day I was getting ready for church and I put the high heels on and I thought, oh, I've made it. I felt so well then that I felt like dressing up, putting jewelry back on, and some of the things that they weren't important to me when I didn't feel good.
I feel extremely well, and if I were an entertainer, I would coin the words of the James Brown. I feel good.
To speak with someone directly about Medtronic's heart failure pacemakers, call Medtronic at 1-800-930-9374.